Hello everyone, welcome to CAPSA. Today we will learn about seizures. So today's topic is seizures. Now, what is seizures? Seizures are basically a burst of uncontrolled electrical activity between brain cells, also called neurons or nerve cells, that causes temporary abnormalities in muscle tone or movements, kind of behavior and sensation. So seizures are a burst of uncontrolled electrical activity between brain cells that causes temporary abnormalities in muscle tone or movements, kind of behaviors or sensation. Now, seizures can be single event due to an acute cause such as medication, or it can be recurrent due to epilepsy. So, it can be single event which is due to medication, or it can be recurrent, that is due to epilepsy. Now, what is epilepsy? So, what is epilepsy? Epilepsy is a chronic brain disorder where group of nerve cells or neurons are involved and which sometimes sends abnormal electrical signals and causes seizures. In epilepsy, brain's electrical rhythm have a tendency to become imbalanced always. So, epilepsy is a chronic brain disorder where group of nerve cells are involved, which sends abnormal electrical signals that causes seizures. So this is epilepsy. Now, what are the triggers or what can trigger the seizures? So the triggers are stress, sometimes drinking of alcohol due to exposure to toxins. What kind of toxins? These can be carbon monoxide, drugs, etc. Due to hormonal changes in female during the menstruation cycle, due to sleep deprivation, due to some visual stimulations like flashing of lights, etc. Now, what is the origin of seizures or from which area of brain seizures originated? These are hippocampus, amygdala, frontal cortex, temporal cortex, olfactory cortex, etc. Among these two are very much important, okay, because these two part mainly originates seizure. Now, what are the types? So, what are the types? It can be actually classified into two categories. First one is generalized seizure. Generalized seizure, and second one is focal or partial seizures. So first we will discuss about generalized seizures. Generalized seizure affects actually both part of the brain. So it affects both side of the brain. And it is again subdivided into two categories. First one is absence seizure, also known as petit mal. In this seizure, it causes rapid blinking of eye and staring into the space for few seconds. So, it causes rapid blinking of eye or staring into space for few seconds. It mainly affects children. The second one is tonic-clonic seizures, also known as grand mal. What happens in this seizure? It makes a person cry out, sometimes loss of consciousness. He or she may fall into ground, muscle jerks, spasm, etc. So, the patient may feel cry out, loss of consciousness, fall into ground, muscle jerks, spasms, etc. It is actually tonic-clonic seizure or grand mal is the worst kind of seizure. Now the next category is focal or partial seizures. It actually affects small area or one side of the brain. In this type of seizure, a person may notice kind of minor symptoms referred to as aura. Okay. Now it is again divided into three categories. First one is simple focal seizure. This seizure causes twitching or a change in sensation such as strange taste or smell. Taste or smell. Second one is complex focal seizure. In this seizure, what happens? It makes a person confused and unable to respond to questions. Confused and unable to respond questions. Now the third one is secondary generalized seizures. In this type of seizure, it actually begins in one side of the brain or one part of the brain but spreads into both sides of the brain. So we can say first it appears as a focal seizure followed by generalized seizure. So first appears as a focal seizure followed by generalized seizures. So this is the end of my lecture. If you like my video, please do like, comment, share and subscribe to Grow Caption. Thank you for watching.